aid tips. Okay, this in-service is on basic first aid tips. Please make sure that you read through all the materials that are attached to this in-service. If you have any questions about anything, please make sure that you call the office at 972-270-2000 and you can speak with Latanya. After finishing this in-service, you will be able to discuss why it is important for you to learn basic first aid, describe the basic steps for handling any emergency, discuss ways to prevent accidental injuries, demonstrate basic first aid tips for a variety of emergencies, including falls, cuts, burns, seizures, and poisoning. Basic first aid. As a healthcare worker, you spend a lot of your workday keeping your clients safe from harm. You help protect them from falls, burns, cuts, and other injuries. But even with the best of care, accidents can happen. Do you feel prepared to provide basic first aid if a client, visitor, or co-worker is injured? The dictionary says that first aid is the immediate care given to an injured or ill person until trained medical help arrives. By performing first aid, you can prevent injuries from getting worse, and sometimes first aid can mean the difference between life and death. As a healthcare worker, you'll probably find yourself in emergency situations more often than the average person. Whether you work in a hospital, a nursing home, an assisted living center, a client's home, or somewhere else, there may come a day when your first aid skills are needed. You'll need to know what to do until a nurse, doctor, or paramedic takes over. Throughout this in-service, you'll read about how to handle a number of different emergencies. But remember, the basic goal of first aid is to give immediate care to the victim. To be successful with first aid, you should observe, quickly look over the injured person from head to toe, checking for life-threatening problems including no breathing, no pulse, or severe bleeding. 2. Start CPR. If the victim has no pulse and is not breathing, begin CPR immediately if you have been trained in CPR. If you don't know CPR, get help right away. 3. Stop heavy bleeding. 4. Look for signs of shock. A victim who is pale and cold with a weak rapid pulse may be going into shock. Shock victims need to lie down on their backs with their legs elevated and with a blanket to keep them warm. 5. Get help. Follow your workplace policy about calling for help. If you're not sure what to do, call 911. And last, avoid moving the victim. Moving an injured person may make the injuries worse, especially if there are back or neck injuries. Try to keep the victim as comfortable as possible and safe from further harm. Basic steps for handling any emergency situation. 1. Important. Use caution. Take a quick look around for any hazards. Be sure you don't put yourself in any danger. You won't be any help to the victim if you get hurt also. For example, if a client has fallen onto a wet, slippery floor, you might fall too if you rush to help without thinking. 2. Check the victim. Ask the victim what happened and if he or she is injured. Usually, conscious victims will be able to respond to you. If they don't respond, they may be unconscious. Listen carefully to what the victim tells you. He or she may be too embarrassed to give you the full story of what happened. Look for obvious signs of injury, such as bleeding or unconsciousness. If the person is unconscious, check for breathing and a pulse. If there are no signs of breathing or pulse, call for help right away. Take note of the time when the emergency occurred. You may be asked later. This is especially important if the client loses consciousness. 3. Get help. Most emergencies that your clients experience will require you to call for help from other staff or emergency medical service. Follow your workplace policy on how to handle emergency situations. 4. Perform first aid. While you're waiting for help, keep the victim as comfortable as possible without moving the person or causing further injury. Never perform life-saving procedures such as CPR unless you're sure they are necessary. Unnecessary procedures can cause injury, and only perform procedures for which you've been trained. Follow basic first aid procedures as needed. Provide emotional support. The injured person will often be fearful or angry due to the stress of the situation. You can reassure the person by keeping yourself calm. To help decrease victim anxiety, listen carefully to what they tell you and let them know what you are going to do to help them. And last, report the incident. You may have to file an incident report. Be sure to learn your workplace guidelines for reporting emergencies. And remember, any information you have may be at great value of the treatment of the victim. How do you practice infection control during first aid? 1. Wash your hands. 2. Wear gloves. 3. Avoid direct contact with blood or other body fluids. And 4. Use a mask with a one-way valve or a face shield. True story. A woman came home to find her husband in the kitchen, shaking frantically with what looked like a wire running from his waist towards the electric kettle. Trying to knock him away from the deadly current, she whacked him with a plank of wood, breaking his arm in 2 places. Poor guy, until that moment he had been happily listening to his Walkman. Basic first aid tips for falls. Falls are common accidents for people who are ill and elderly. A fall can result in serious injury, including cuts, head injuries, broken bones, and damage to internal organs. Check out the situation. Did the client fall because the floor was slippery or cluttered? If so, be careful that you don't fall. Did the client fall because he was weak when he got up? Did the client fall because he passed out? Check out the client. Check to see if the person is conscious. If so, try to find out what happened. Check for life-threatening problems first, such as unconsciousness, no signs of breathing, no pulse, or severe bleeding. Look for any signs of broken bones, such as sharp pain, discoloration, deformity, or swelling. And get help. Follow your workplace policy on whom to call for an emergency. Report the fall to your supervisor. Your main goal is to check for serious injuries. The CDC reports that one of every 3 senior citizens falls every year, and nearly 10,000 of them die from their injuries. Basic first aid tips for an unconscious victim. If you find a victim lying on the floor, you need to determine if the person is unconscious. Shake his or her shoulders and shout, "Are you okay?" If there is no response, the person is probably unconscious. Here are some tips to help an unconscious victim. Always check for airway, breathing, and circulation. Without breathing and/or a pulse, death will follow quickly unless CPR or other life-saving efforts are performed. During CPR, the rescuer blows air into the mouth and compresses the chest over the heart. This procedure puts air in the lungs and keeps the heart pumping. CPR can only be done by someone who is formally trained. Basic first aid tips for broken bones. When a bone is broken, it is said to be fractured. There are different types of fractures. Complete fracture. This is when the break goes completely through the bone. Incomplete fracture. This is when the break only goes part way through the bone. Compound fracture. This occurs when a sharp piece of broken bone pokes through the skin. Serious bleeding can happen with a compound fracture. And a simple fracture. This kind of fracture doesn't go through the skin. However, without proper treatment, this can become a compound fracture. Fractures can occur suddenly from a fall or other direct injury to the bone. They can also occur from using a bone over and over, causing a small crack. This is called a stress fracture. Some illnesses, like osteoporosis and cancer, cause bones to break very easily. The symptoms of a broken bone or fracture are bruising, swelling, obvious deformity, and pain and tenderness. Remember, you should first get help. Cover the part that's injured with a sterile towel, sheet, or pad. Put on a splint to prevent the bone from causing further damage or injury. Keep from moving the person, however, to keep him comfortable, or reassure him that you are there to help. Your main goal is to keep the person comfortable and prevent further injury. Cuts are commonly caused by sharp objects as well as blows from blunt objects that split the skin. The edges may be jagged or smooth. A cut may not be painful if nerves are injured, and a deep cut can also cause damage to vessels and other soft tissue. A little bit of bleeding can be a good thing. It helps remove dirt from the cut, but too much bleeding is a problem. Here's what you can do for cuts. Find out where the cut came from. Is there broken glass on the floor? Be careful not to cut yourself. Remember to use standard precautions to prevent spreading infection between you and the victim. Follow your workplace policy on whom to call. Find out if it's the doctor, nurse, or 911. You should first clean the cut thoroughly with soap and warm water, carefully washing away any dirt. Don't use rubbing alcohol, iodine, or mercurochrome as they can harm tissue and slow healing. Apply direct pressure until bleeding stops. Put on a sterile adhesive bandage to continue pressure. If cut is deep, get help quickly. Your main goal is to stop the bleeding and prevent infection. Infection, not blood loss, is the biggest risk with cuts. Even a small cut can allow millions of germs to enter the body. For clients with a weakened immune system due to age or illness, this can be deadly. Basic first aid tips for scrapes. Scrapes are caused by the scraping or rubbing away of the top layer of the skin, which exposes the underlying nerve ending. This is why scrapes are so painful. As an added bonus, dirt and other matter often enter the wound and make it a target for infection. To treat a scrape and prevent infection, first, wash thoroughly with soap and warm water. If the scrape oozes or bleeds, bandage it to protect from infection. Keep the scrape dry and clean and report the scrape, including what caused it. Basic first aid for hemorrhage or bleeding. A hemorrhage is a lot of bleeding from an external wound, such as a stab or compound fracture, or from an internal injury, such as bleeding ulcer or trauma to the chest or stomach. Internal hemorrhage may show up as skin discoloration or blood in the urine, stool, or vomit. The person will probably feel pain and tenderness in the affected area. A person that is hemorrhaging may go into shock, lose consciousness, and die if the bleeding isn't stopped. Your main goal is to control the bleeding and get help fast. Remember to use standard precautions anytime you come in contact with blood. Try to keep an extra pair of latex gloves with you at all times, just in case. Check for consciousness, respiratory arrest, or cardiac arrest. Stopping the bleeding won't help if the person isn't breathing. Follow your workplace policy on whom to call, and when in doubt, call 911. Basic tips. While you are waiting for help, have the person lie down. Apply direct pressure to the wound with a sterile gauze or pad. This will help the blood to clot and stop the bleeding. If blood soaks through the gauze, don't remove it. Instead, place another gauze on top and continue to apply pressure to the wound for 5 minutes. Elevate the injury. Position the wounded part of the body above the level of the heart if possible while you apply direct pressure. After 5 minutes, if direct pressure and elevation hasn't worked, you'll need to do more to stop the bleeding. Large arteries that are found close to the skin surface supply blood to the head, each arm, and each leg. The bleeding may stop if you apply pressure to the major artery supplying blood to the wound. You do this by pressing your middle 3 fingers over the artery's pressure point. If using the pressure point on the leg, you may need to use the heel of your hand instead of your fingers. Be sure not to cut off circulation completely. Pressure points are where the pulse can be felt by placing a finger against an artery. The most common pressure points used during first aid are located in the upper arms and in the creases above the upper legs. To apply pressure, use 3 fingers, index and 2 middle, over the pressure point. Provide emotional support. The victim may be confused and scared. It will be reassuring if you remain calm and supportive. Report the incident. Following your workplace policy, be sure to report and document what took place and what you did. Question: how much blood can a person lose before it becomes life-threatening? The answer: adults have about 5 or 6 quarts of blood in their bodies. If someone loses a quart of blood in a short period of time, it can be fatal. Hold on. If a person is choking, you shouldn't get in the way as long as they are coughing. If coughing doesn't remove the object and the person is breathing with extreme difficulty, turning a bluish color, and is unable to cough or speak, quickly ask, "Are you choking?" A choking victim can nod their head yes, but will be unable to talk. If the person is choking, first stand behind him with your arms at their waist. Place one fist with the knuckle of the thumb against the person's midsection, slightly above the navel, but well below the breastbone. Hold your fist firmly with the other hand and pull both hands sharply toward with an upward and inward jab, like the letter J. This is called the Heimlich maneuver. This procedure should be done until the object is forced out of the victim or if the victim becomes unconscious. If the victim becomes unconscious, help them to the ground and get help right away. Basic first aid for seizures or convulsions. Seizures or convulsions are uncontrollable temporary disorders that can be caused by epilepsy or sudden illness. Sometimes seizures are barely noticeable. At other times, they cause severe muscle spasms. They aren't likely to cause death unless the victim stops breathing. However, seizures may require immediate medical attention. Your main goal is to keep the person from getting injured. Assess the victim. Is the person having a major seizure? Has the person injured their head in a fall? Are they diabetic or epileptic? You should first gently lower the person to the floor. Clear all objects away from the victim and place a pillow or rolled towel under the head. Turn the head to the side. Do not place anything between the teeth or in the mouth. Keep the person from getting hurt on nearby objects such as sharp edges of furniture by cushioning the victim. Never try to restrain the victim. After the seizures are finished, position the victim on his side. Make sure the person is breathing. If not, check to see that the airway is open, and if you are trained, begin rescue breathing. Stay calm and keep the person comfortable until help arrives. Basic first aid tips for poisoning. People can be poisoned by taking too much medication, ingesting household chemicals, or eating spoiled foods. They can also be poisoned by breathing poisonous gases, touching poisonous plants, or from insect bites. Accidental poisoning happens over 1 million times every year. If you come across someone who you think may be poisoned, you should try to determine the source of the poison. Then get help quickly. For a poison victim, the most important time is the first hour or two. Get help quickly. Here's what else you can do. See if there's any obvious source of poison. Do you notice any unusual odor? Remember that carbon monoxide coming from faulty heating equipment has no odor. If necessary, get the victim away from the poison. Are there empty medicine bottles near the victim? Can you see solid pills in the victim's mouth? You can try to remove them using a clean cloth wrapped around your finger. Is the client breathing or conscious? If so, ask the person to tell you their symptoms. If not, inspect their mouth and smell their breath for signs of poison. If you suspect gas poisoning, open the windows immediately. If the problem is gas from an oven, turn it off. Get the victim and yourself away from the gas so that you can breathe fresh air. If you suspect chemical poisoning from a household cleaner, for example, do not induce vomiting. Call your local poison control center. You may be instructed to give the victim water or milk to dilute the poison. If you think the victim has gotten poison on their skin, such as the toxins from a poisonous plant, wash the affected area with soap and cool water. Be sure the water and/or washcloth used doesn't touch healthy skin. Your main goal is to get help right away and follow any instructions given to you by poison control. Be sure you know the telephone number for your poison control center. Ready for the first degree about burns? Burns from cooking, hot beverages, and hot bath water are common accidents. Burns can be painful, but small burns on adults are rarely serious. Large and/or severe burns can be very serious, even life-threatening. Before giving first aid for burns, ask yourself, is the person in danger of more burns? For example, if clothing is on fire, help the victim stop, drop, and roll. Is the skin red, swollen, blistered, or broken? What is the person's age and medical condition? The elderly and children are at risk for complications from burns. How deep or severe is the burn? Ever wonder what those degrees mean? First degree burns involve only the outer layer of skin. The skin is dry, painful, and tender to touch. This type of burn can come from a hot water bottle, a heating pad, or a mild sunburn. Immediately put the affected part under running cold water or wrap cold, wet cloths on the burn until the pain decreases. Cover with a clean, dry gauze dressing for protection. Second degree burns involve severe layers of skin. You may see blisters, swelling, and red skin. The victim will be in a lot of pain. An example of a second degree burn would be skin scalded by hot water. Immerse in cold water or apply cold, wet cloths immediately. Do this before you call for help. Gently blot the area dry. Don't rub, as this may break the blister, open it to infection. If the burn is on an arm or leg, keep it elevated as much as possible. Keep in mind that second degree burns usually heal within a few weeks. Third degree burns involve all layers of the skin and many underlying tissue or organs. They are less painful than second degree because the nerves are destroyed, but the damage to the body is greater. Do not remove any clothing near or at the site of the burn. Don't apply cold water or medication. If burns are on arms or legs, keep elevated above the heart. If burns are on face, check to make sure the patient isn't having trouble breathing, and get help right away. Burns kill the skin by layer and are classified as first, second, and third degree depending on the depth, not the amount of pain or the extent of the burn. Things you should not do for burns. Don't apply ice to a burn. This may cause further damage to the injured skin. Don't touch the burn with anything other than a dressing. This decreases the risk of infection. Don't break or pop blisters. Don't apply butter, oil, or lard to a burn. Don't remove pieces of clothing that stick to a burned area. Don't give a burn victim anything to eat or drink. Things you should do for burns. Do remove rings, bracelets, watches, or shoes from the burned area. Swelling may make them difficult to remove later. Do remember that cold water is the best immediate treatment for minor burns. It lowers the skin's temperature and lessens the severity of the burn. Do make sure the source of the burn has been extinguished. Do not put yourself in danger. Do have the person lie down to prevent shock. Your main goal is to protect the victim from being burned any worse and to get help right away. Every year, over 2 million Americans need medical attention for burn injuries. About 20,000 people are admitted to special hospital burn units every year. Nearly 10,000 people die from severe burn injuries every year. Basic first aid tips for heat exhaustion. Heat exhaustion occurs when the body can't sweat enough to cool itself off. It usually happens when someone is working or exercising in hot weather, but can happen to people living in areas with poor air circulation. The person may complain of weakness, fatigue, headache, dizziness, and nausea, cool, clammy, red or flushed skin, or profuse sweating. You should get the person out of the heat and remove loose fitting clothes. Give the person plenty of water or Gatorade to prevent dehydration after the nausea passes. Sponge the person with cool water and make sure the person gets plenty of rest. Basic first aid tips for a heat stroke. Heat exhaustion can sometimes lead to heat stroke, a potentially fatal condition. When people suffer from heat stroke, their sweat glands totally quit working. The body temperature raises to 105 degrees or even higher. Heat stroke requires immediate medical treatment. Here's how to tell if someone is having a heat stroke. Mental confusion, staggering gait, unconsciousness, hot, dry, red, or flushed skin, high fever, or rapid pulse and breathing. You should get the person out of the heat and or sun immediately. Check to see if the victim is conscious. Call 911 or your supervisor immediately. Pour cool water over the person or wrap him or her in cool wet clothes. You can also cool the person down by using cold packs. Once the temperature decreases to about 101, you may lay them in the recovery position. If the temperature begins to increase again, repeat the cooling process. If the victim is able to drink, give some water, but only a little bit. Give no more than a half of a cup every 15 minutes. Your main goal is to cool the person down and get help. Basic first aid tips for hypothermia. Hypothermia occurs when the body temperature drops below 96.8. It happens when the body loses heat faster than heat can be made by muscle contraction and shivering. Frail and inactive people can develop hypothermia indoors if they're not dressed warmly. The first symptom of hypothermia is uncontrollable shivering. As it progresses, you may notice the victim having dizziness or lightheadedness, muscle stiffness, and difficulty moving. If no treatment is given, the following symptoms occur: slurred speech, slow pulse and slow breathing, memory loss or confusion, blurred or double vision. If there is still no treatment, the victim will suffer unconsciousness, cold stomach, and eventually death. You should take the person indoors or to an area of shelter. If the person's clothes are wet, take them off and replace them with warm, dry clothes as soon as possible. The victim may want to wrap up in a blanket and sit near a heater or fireplace until warm. Remember that the body temperature must be raised slowly. Warming the person's body too quickly can cause damage. Give warm liquids if the victim is conscious. Don't give anything with caffeine. Make sure the victim gets medical attention as soon as possible. Your goal is to warm the person up and get help immediately. Your clients can prevent indoor hypothermia by dressing warmly and keeping the temperature in their house above 65. Shivering may stop if body temperature drops below 96, and remember, it doesn't have to be freezing outside for hypothermia to strike. Hypothermia can happen at temperatures of 45 degrees Fahrenheit or even warmer if the weather is wet and windy. The best first aid. Accident prevention. What are the chances that you'll ever need to use your first aid skills? Well, consider this. Every year, millions of people are treated in emergency rooms for injuries they receive from everyday accidents. Many of these accidents may be prevented by following these safety precautions. Remember them as you work with your clients. Keep all small appliances such as coffee maker, hair dryer, or electric razor unplugged when they are not being used. Make sure the hot water coming from the bathroom faucet isn't too hot. Make sure there are non-skid strips or mats on the bottom of the bathtub or shower. Keep stairways clear of clutter and well lighted. Check to see if your client's area rugs are securely fastened to the floor with carpet tape or rubber matting. Make sure there aren't any electrical cords or wires where people might trip over them. And be on the lookout for frayed electrical cords which could cause a burn or fire. Make sure that your workplace has smoke detectors. If you work in clients' homes, encourage the client or family to install a smoke detector. Be sure you and your clients know the emergency exit in case of fire. Don't let a client sleep with a heating pad and don't tuck in the ends of an electric blanket. Don't allow clients to smoke in bed. Some clients may need to be supervised while they smoke to prevent accidental fires. Make sure you have enough help when transferring heavy clients between their bed and wheelchair. If you struggle to perform the transfer by yourself, the client may end up with bruises or cuts from sharp edges on the bed or wheelchair. If your clients tend to get out of bed at night, make sure they have a nightlight. You don't want them stumbling around in the dark. If you work with confused clients, make sure that medications and household cleaners are kept out of their reach. If you notice your clients using expired medications, notify your supervisor. Encourage your clients to wear rubber-soled shoes or slippers, not just socks, when walking around. This will help avoid falls. If you work in a facility, be sure you know where the first aid supplies are kept. If you work in a client's home, consider keeping a first aid kit in your client care bag. Remember, your goal is to keep your clients safe. Just in case an accident still happens, be sure you know the emergency numbers to call. If you work in a facility, there may be a special code used to call for help. If you are a home health aide, emergency telephone numbers might include ambulance, police, fire department, poison control, client's emergency contact, and physician. First aid kits. Everyone should have a first aid kit, whether you buy or make one yourself. A first aid kit should contain flashlight and batteries, a pocket mask with a one-way valve for CPR, tweezers and scissors, emergency blanket, triangular bandages, antiseptic toilettes, adhesive bandages in assorted sizes, sterile gauze pads, elastic bandages, adhesive tape, antiseptic ointment, latex or nitrile gloves, plastic bags, instant cold pack, syrup of ipecac, activated charcoal, and emergency numbers.